Hello, welcome to Oregon Surgical Institute's Discharge class. My name is Sarah. I'm an orthopedic care coordinator here at Oregon Surgical Institute, and I'm also a registered nurse. Today, some things we're going to talk about. We're going to talk about reasons to contact your surgeon and how to contact your surgeon, taking care of your incision once you get home, preventing complications once you get home, as well as activity. What is too much activity? What is too little activity? We're also going to be talking about pain management, how you're going to manage your pain, and expectations on how to do this. Some things to keep in mind, some things to monitor and look out for at home, and some reasons you might need to call your surgeon once you get home. Pain is very normal. Pain is very expected after this procedure. We do expect you to be able to walk and put some weight down on this joint, though. We also expect your pain medicine to be helping you do this. If you're at home, though, and you're in excruciating pain, you can't get up, you can't move, you can't walk on it, and your pain medicine is doing absolutely nothing to help you, definitely call your surgeon and let them know. If there's any signs or concerns of an infection once you get home, let us know. Things to look out for would be redness that begins to spread away from the incision. Any kind of overwhelming or excessive drainage we want to know about. A few spots of blood on the bandage is not a big deal, but anything that's oozing out of the bandage or saturating it, we definitely want to know about. Also, any drainage that's persisting after the first 7 days, we want to know about. After 7 days, you're going to take that bandage off and leave it open to air. And at that point, there should be no active drainage coming from the incision. If there is, or if there's any new drainage that starts up after that, we definitely need to know about it. Keep in mind looking out for blood clots. You must look at both legs when it comes to this. So some things to look out for with blood clots would be swelling that does not minimize at all with regular ice and elevation, redness to the calves, and tenderness to touch in the calf area as well. If you notice any of these things in either leg, please call your surgeon and let them know. For anything that just doesn't seem right or anything you just want to put your mind at ease about, definitely reach out to us or to your surgeon's office. We're here at the center Monday through Friday during normal business hours. Your surgeon's office always has somebody on call. You can call them 24/7. Medical emergencies are rare after this procedure, but things to keep in mind are some reasons why you might need to call 911 after surgery. These are really all the reasons you would always call 911. If there's chest pain, if a patient's having shortness of breath, if there's any sign of a stroke, like facial drooping, slurring of the speech, or unexpected weakness on one side of the body that's not on the other. Incision care. So everybody will have some form of a waterproof covering over the top of their incision. For some of you, it might just be a layer of skin glue that's waterproof. For some, you might have an actual bandage that's waterproof. Either way, you can take a shower the day after surgery. You just let warm soapy water run over the top of your incision. You pat it dry with a clean towel and you put on clean clothes. That's it. If you have a bandage, you'll remove that bandage 1 week after surgery. It peels off like a big Band-Aid and you throw it away. And at that point, you do nothing else with your incision. You can still take a shower every day. It can be open to air. You let warm soapy water run over that incision in the shower. You pat it dry with a clean towel and put on clean clothes. We do not want you to submerge your incision at all until your surgeon says it's okay to do so. So no baths, no hot tubs, no swimming pools yet. Once that incision is open to air, no hands are touching it, no scrubbing it in the shower, no lotions, no ointments, no topical medications of any kind should go on top of this incision. We really just leave it alone. Clean towels every day for the next 2 weeks, clean clothes every day for the next 2 weeks. As far as pets go, if you do have pets in your house, some things to keep in mind. We don't want any pets in bed with you for the next 2 weeks. We don't want any pets licking your incision. And we just want to ensure that no pets are going to be a tripping hazard for you whenever you're up walking. A few complications to touch on. Blood clots, fairly uncommon complication. As we mentioned before, some things to keep an eye on and monitor for blood clots would be swelling that does not minimize with ice and elevation, redness to the calves, and tenderness to touch in the calf area as well. But prevention is very important for blood clots, okay? So some things that we definitely need patients doing are lots of ankle pumps and ankle circles throughout the day. Just moving those feet around, okay, is very helpful to prevent blood clots. Patients cannot do this too much, okay? You can do this whenever you're resting but awake. I always say a commercial break on TV is always a good time to remind yourself to do it. Or if you're reading a book, maybe every time you turn a page, having some kind of cue during the day to help you whenever you're resting but awake is helpful. Also, aspirin. If you're a patient who doesn't have any significant cardiac history, if you're not already on a prescription blood thinner, and if you've never had a history of any kind of blood clot, you'll be doing aspirin as your blood thinner after surgery. This is just an 81 milligram aspirin, or baby aspirin as they call it. You'll be using this twice a day for 6 weeks after surgery. Constipation. It's something we see quite often. The anesthesia and the narcotics after surgery can cause quite a bit of constipation. So it's important that we restart those guts as fast as we can after surgery. All the normal things are very helpful, like drinking water, eating a well-balanced diet, all very helpful, but most of the time we need some help with some over-the-counter medications as well. We want all of our patients starting on a stool softener and a laxative starting when you get home from surgery. And we want you doing this twice a day for as long as you need it. Please don't go more than 3 days without having a bowel movement, okay? If you get to the 3-day mark, you have not yet had a bowel movement, we definitely want you to add a laxative to your regimen. We'll be sending you home with a sheet that goes over a lot of the over-counter medications that are available and what we'd like you to take and what we'd like you to add to that regimen if you do run into that problem. Swelling and bruising, very common after surgery. And if you're having a knee done, you're susceptible to more swelling than a hip. Sorry, knees. You might bruise, you might swell, whether you're a hip or a knee, from your hip to your toes. Very normal, very expected, okay? The swelling can cause a lot of the pain after surgery. So we do want to help reduce the swelling in order to help reduce the pain. Icing and elevating is the only thing that's going to help with the swelling. Icing can be done on and off throughout the day. Ice should only go on for about 20 minutes, and there should definitely be a clean barrier between your skin and the ice pack. Ice should go on for 20 minutes, then it should come off for about an hour. But that rotation can go on and off throughout the day as much as you find helpful. Elevating is also very important. Elevating is toes above nose. This is the only elevation that's going to help bring that swelling down. So we need our patients to lay back fairly flat, get that foot up on multiple pillows. Pillows should go underneath the ankle when elevating. This is how you're going to spend a lot of your day, okay? If you're not up and walking or doing your exercises, you're probably going to be laying back with your feet here. Activity. Activity is an important factor here. It's important to not do too much. It's important to not do too little. You're going to get a list of exercises today from the physical therapist. We want these exercises to be done 2 to 3 times a day after surgery. They should take about 15 minutes each time. We don't want you to do any more than this, okay? You can't exercise your way to a quicker or faster recovery, unfortunately. Walking is also extremely important. We want you to be up and walking every hour while you're awake, but just for 5 or 10 minutes. So these are frequent walks, but they're short walks just around the house and on flat surfaces. No driving and no working until your surgeon has cleared you to do so. Fatigue is very common after the surgery. Difficulty sleeping is very common as well. So making sure that if you are taking naps during the day, that they're short naps. Try not to sleep the day away because that's when we want you up and doing your activity. Ideally, we like our patients to sleep at night and awake during the day. There's no need to elevate the leg when you sleep at night. Since sleeping is a little bit challenging after this surgery, we just ask that you find a comfy position and a comfy place There's no rules on positioning when you sleep, okay? Get in a comfy spot and get some rest, because rest is very important to healing as well. Stairs are possible after surgery. Patients are capable of doing stairs, but we don't want them doing it too much. We will show them today how to go up and down the stairs. Coaches will be with us when we do this, so they also see how the patient is supposed to do the stairs. Stairs should be limited to at most 2 round trips per day. That's it. Stairs should not be done for exercise. Stairs are just to get you from point A to point B when you have to. That's all. Pain management. So like I said before, pain is normal and pain is expected. Unfortunately, you're not going to be pain-free right away. Your pain meds are also not there to make you pain-free. They're there to give you a functional level of pain, meaning you can get up and walk on this joint, you can put some weight on this joint, and you can tolerate it. That's what we're looking for in terms of pain control. Everybody should have received some form of a narcotic pain pill from their surgeon prior to surgery. This is used for the most severe pain, but it does have lots of side effects to it. So we don't just rely on these medications. We're also going to use some over-the-counter medications to help reduce the amount of narcotics people have to use. Tylenol is a great example. Unless you're allergic to it, all of our patients will be on a Tylenol regimen after surgery. If patients can tolerate an anti-inflammatory like Advil or Aleve, that will be used as well, most likely after surgery. Then, if the pain is not at a tolerable level with the Tylenol and the anti-inflammatory, then you'll use a narcotic pain pill like an oxycodone or tramadol. Okay. These medications, like I said, have a lot of side effects: dry mouth, itching, constipation, nausea. Some food in the stomach is definitely helpful to offset some of that nausea. Lightheadedness and dizziness is also a side effect, as it is with anesthesia. So it's extremely important that all of our patients go home with help from somebody 24 hours a day for 2 to 3 days at the minimum, okay? We never want a patient up by themselves for the next 2 to 3 days. We want somebody with them. If they are feeling lightheaded or dizzy, it's imperative that they do not fight through that, but that they lay down, they drink fluids, and they rest. After a little bit of rest and fluids, most patients, as long as they move very slowly and change position slowly, can get up with resolved dizziness. If this is not resolving though, we would ask that you call your surgeon. Today, we're going to be making a chart, a medication chart for all of our patients. It's going to go over what medications that they're on, what time they'll be due at, what time they had their last dose here, and how often they should be taking these medications. We will go over this with the patient and the coach before they leave here today so that everybody is on the same page and so that everybody has a form that they can chart all the medications on. It is extremely easy to forget what time you take those pain medications, especially when you're on pain medications. So it's really important that you write those things down. As you begin to feel better though, you can begin to taper down off of those narcotics. So if you are taking narcotics, it's important not to stop them cold turkey, but to reduce the dose slowly over a few days before stopping it completely. Keep in mind, this is a slow marathon. There's nothing that can be done to speed up this process. It's important that patients don't overdo it, nor that they underdo it. But as long as they follow the rules and stick to the plan, they'll do great. Also keep in mind, the pain gets worse before it gets better. We give lots of nice numbing medication in that joint today during surgery, and this lasts a day or two. After that, it's going to start to wear off, and that leg is going to feel stiff. It is going to feel sore. It might even feel like it weighs 10,000 pounds. This is very normal. It is very expected. Nothing has gone wrong, okay? It's a couple days. They're not always fun, but you'll get through them. Maybe it takes a little bit more ice and elevation. Maybe it takes a few more pain meds, but we still want you to get through it, okay? Towards the end of the first week, you should start to see the light at the end of the tunnel. But there's going to be good days and bad days for the next couple of weeks. And then you're really going to be off and back to the lifestyle that you had the surgery for in the first place. If you have any questions, please don't hesitate to reach out to us at any time. Our phone number here is 971-708-0400. We are here Monday through Friday during regular business hours. If there's anything that comes up over the weekend, in the middle of the night, as I mentioned before, your surgeon always has somebody on call for them 24/7 just by calling their office phone number. Thanks and take care.